Okay, this video is what is the main side effect of imaging, like CAT scans, MRI, ultrasound, x-rays. And, first of all, a joke. What is the definition of a healthy person? Someone who hasn't had a body CT yet. And the reason for that statement is if somebody gets a body CT means, the chest, abdomen, and pelvis. The vast majority of patients will have what are called incidental omas, meaning sort of unexpected findings that are very common. A typical thing with a chest CT is to find little small lung nodules. We call them micronodules if they're like, let's say, 4 millimeters or less. They're quite often in the periphery of the lung called the subpleural region. And a person will need to get followed up typically for at least 2 years to make sure they're not cancer. If they don't grow in 2 years, they're not cancer. If they don't grow, if they're ground glass, meaning partially not solid, then you could have to follow them 4 years or more. So what I'm trying to say is regular patients tend to be afraid of radiation. Oh my goodness, all the radiation from this CAT scan. But what a radiologist, somebody who really knows imaging, they're afraid of incidental omas. And the same thing happens with many different types of imaging. Think about mammography. Lots of times there's a false positive and the person has to go for an unnecessary biopsy. They're all worried. They're afraid they got cancer, or they have to get follow-up imaging again for months or years, and it puts their whole life on hold. They're afraid to buy a house, get married, or do all kinds of things because they don't know if they've got cancer. They might die soon or whatever. But there's a lot you can do if you have cancer, by the way. It's not as simple as people think. I've given a whole bunch of lectures on that. So anyways, just typical things. You do a CT of the abdomen. It's pretty routine to find a little adrenal nodule. They're almost always nothing unless they're really big, over 3 centimeters. It's routine to see normal variants like kidney cysts and liver cysts. In the bones, we'll see all these benign bone islands in the spine, these atypical hemangiomas. So what I'm trying to say is, if you need imaging, it can save your life. It can be a great thing, okay? But to just randomly go for imaging without a very specific, precise, exact purpose is a risky thing to do because everything depends on pretest probability. If your pretest probability is very high, then it might be valuable to image. You got severe acute abdominal pain, you might have appendicitis or something. The smarter thing is, be a low-fat vegan so you don't get appendicitis. You almost never get appendicitis. That sort of approach. Other things are like a lot of people say, well, should I go for coronary artery CT? CAT scan of the coronary arteries of the heart. And I would say, well, you got atherosclerosis if you ate the SAD diet in the past, so just start doing the treatment. Start eating like an Esselstyn diet, low-fat, low-sodium vegan diet, etc. No caffeine, no alcohol, no sweets. So anyways, yes, you don't want excessive radiation. For example, a coronary artery CT scan with intravenous contrast, that's a pretty decent amount of, it's like many thousands of x-rays. That's some radiation. But the radiation itself from 1 or 2 CAT scans is nowhere near as big a deal as these incidental omas. These can really change your life. So, for example, I'm an expert on imaging, triple boarded. I would never image myself if I didn't absolutely have to. And I have done so a few times in the past, and I was lucky. I got away with it. I didn't have any significant incidental omas. But, man, I was also young at the time. Now I'm older. I wouldn't get on that table unless I had a good reason. Sometimes you have a good reason. There's a lot of good reasons to image, but you just don't randomly do it unless you have a very good reason. So, anyways, that's it.